Healthcare services at many private hospitals in the country are likely to be hit today as the Indian Medical Association, or IMA, has called for suspending routine services for 12 hours to protest a bill seeking to replace the Medical Council of India, or the MCI, with a new body, the National Medical Commission Bill, which was tabled in Parliament on Friday, seeks to replace the Medical Council of India and also proposes allowing practitioners of alternative medicines such as homeopathy and Ayurveda practice allopathy after completing a bridge course. The bill is likely to come up for discussion in Parliament today.
The NMC bill, which is going to be tabled in the Parliament, has some clause, and it one of them allows any medical graduate, any other system medical graduate, maybe homeopathic, Ayurvedic, or any other medical graduate can practice medicine by passing a bridge course. This is highly objectionable. It is MBBS is the basic qualification. As on today, the MBBS is the basic qualification to write any modern medicine drug. If you open, if you allow any other practitioner, any other medical graduates to practice medicine, it's going to be very detrimental for the public health of Kerala.
Well, what we also understand is that Dr. K.K. Agarwal, who is the former president of the IMA, or the Indian Medical Association, that is protesting today, remember, they've already written to the Prime Minister Narendra Modi and the Health Minister urging them to redraft the bill. So they're not completely opposed to it. Snigdha Basu tracking all the developments. Snigdha, just tell us, what's the biggest concern for the IMA? They want to redraft the bill. What is the problem there that they see? Is it about quackery?
Well, the National Medical Bill, the Indian Medical Association is against a lot of things in bill. One of them is that they say that the bill is not national, which means it's not going to be representative. Currently, all the states had a representative, which means all the states had a stake in the policy making. But now, according to the new Medical Commission Bill, it will only have 5 representatives, which will be elected by the central government. Though health is a state, but the states will not get its appropriate representation. The other thing that they're against is that it will allow Ayurveda as well as homeopath doctors to practice allopathy medicine with a bridge course of 6 months. Now, what the doctors say, the IMA doctors say, that we have done a degree, an MBBS degree, for 5.5 years, and you are saying that an Ayurveda doctor can now prescribe allopathy medicines with just a bridge course. Now, remember, homeopathy doctors also do a 5-year course, but the pharmacology, know about which medicine to prescribe, because allopathy and homeopathy are very different. That is very different for both the streams of medicine. How is it that an Ayurveda doctor can now prescribe allopathic medicines with just a bridge course? So there's not just one. In fact, there are about 6 different things that the Indian Medical Council say is wrong in the National Medical Commission Bill, that it should be debated. In IMA officials also went to the Ministry of Health yesterday to discuss and debate these issues. They say that these loopholes that lead to corruption need to be plugged instead of changing the entire system, because the new system will be very anti-poor, very anti-doctors, as well as very anti-community.
All right, Signa, that's interesting. But tell us one other thing that I want to ask you about. It is, in a way, a positive step to actually ensure that Ayurveda and other forms get encouraged through this particular bill. But you're trying to find a middle ground, and that could take some time. In effect, with triple talaq also happening in Parliament today, can we expect that the attention that is due and should be given to this will actually be given in Parliament?
Well, Amitoj, what the Ministry of Health is actually trying to do is bridge that big, huge doctor-patient ratio that India has. Aren't enough doctors to treat the number of patients that stream into the public healthcare system. So what the government wants to do is get on more doctors on board to treat more patients. But what the allopathy medicine doctors say is that's not the right way. This is not the right way to do it. There are a lot of different things, not just the Ayush integrating with allopathy, but also, different aspects of the commission bill, which will lead to less representation of state doctors, representation of community. So currently under the Medical Commission Bill, if a patient has a grievance, they can go to the grievance cell, but under the new system, a patient will not have that power. A patient will have to go and court, and we all know how long those procedures can take. So they say that it is not just anti-doctors, but it is also anti-patients.